Is Queens over on east? Is it north of Brooklyn?
I have no idea.
Shoot, what is it? Oh man, yeah. Anyways, sorry for the people that live in New York. They're just like, shit. Hey everybody, this is Dr. Warren here, Kalkstein Chiropractic with Marjorie, and you and I met at the YMCA turkey trot here in Towson.
Yeah.
And your son was there with you, and it was all about your son then, and he was dealing with some kind of pretty regular headaches, migraines, and we talked a little bit about chiropractic care as it relates to treating those type of things, as well as being mindful about all the different angles we need to play for kids that are dealing with chronic migraines. And you are well familiar with that field, if you will, in neurology and having co-management from different specialties. And so I definitely think Caroline might be a good resource internally. So we have a nurse practitioner who's a little more functional med primary care that's in-house, but has a history and practice in emergency room medicine as well as in primary care settings. So it might be a good kind of talking point with Dr. Angie, who's taking care of him, to use Caroline as well.
Okay, great.
Okay. And so you didn't even say anything that you were dealing with anything when I first met you.
Right.
Let me say that a little bit better. She didn't bring up any problems with me. It's all about her son during the visit. And then, yeah, I saw you in the waiting room and I was like, hey, good to see you again. And it was your appointment, right?
Yes.
So tell me a little bit about kind of what brought you in and then what your experience has like been so far as it relates to your problems that you brought in.
Yeah, so I had I feel like a lot of overuse in my body. I had a very physical career, and
You still do.
And I still do.
Yeah.
As a nurse. So when we saw you at the YMCA clinic, I just liked your approach, their holistic approach, with incorporating physical therapy and exercise. So I came in because I've had lower back pain and neck pain for quite some time, probably 20 years, and it was just getting more frequent and constant now that I'm getting older. So I was just happy to be able to come in, and I'm already seeing improvements in just a couple weeks. So
Nice.
And better mobility, posture correction has been really helpful.
I'm glad you're getting good results early on. Like intention is that right there. Relative to it, and she spoke about like holistic care, and we see it as combining conservative care as a whole, and not putting ourselves in a camp and being open-minded, as well as setting up an environment to be really conducive for patient needs. So that looks like she gets chiropractic care here. She gets dry needling periodically. We haven't utilized Shockwave with her, but she's incorporating advanced physical therapy with us to the point where we're kind of leaning into some strength training with her as well. We diagnosed on the front end accurately a lower back and potentially some discogenic pain that had subsided, but she was still limited in the way she moved in her lower back. She had a history of a problem in that area that we really didn't fully understand until we examined it and saw that there was still some functional changes in the way she moved from one side to the other. So you had some positive neural tension on that right side of her lower back, as well as some changes in the way she moved with her lower back. So we were able to address that, and it's starting to show early on as it relates, not just because she feels better, because she's moving better. And so that's kind of like a summary of where she was. She deals with some more chronic, like shoulder, upper back tension and pain. So I'm going to speak to two kind of maybe topics that people come in here with that have a lot of questions relative to structural changes in the spine, okay, versus functional. So a lot of people have structural differences. I have structural differences in my spine, right? So I can relate to this to both sides of the coin, understanding that I have it as well as perceptions that people have about it. And I always come back to some of the famous people that have, athletes that have structural shifts or changes in the spine. So if there's any deviation or rotation in the spine itself, so Usain Bolt has that, right? Like there's elite level athletes that move really well that structurally are not normal, okay? I wouldn't say I'm an elite level athlete, but I'm structurally not normal for sure. I have something called facet tropism, and so my facets don't align in a similar manner. There's one that's like this, and one that might be like this for an exaggerated purpose, okay, in my lower back. Understanding what that can do over time as it relates to where we hold patterns of stress is where I come in, and then reinforcing that good movement that we're going to do in that area. All right, so in a nutshell, I just talked about like kind of congenital things that we are naturally born with or that we develop over time, abnormalities that would show up on imaging, like scoliosis, and then where we might have patterns of stress because of them, and then how I approach it here, right? Scoliosis is a big, broad topic as it relates to that, but deviations and slight rotations can show up minorly. You might not even know you had it your whole life, right? So that's one component, right? And then the other thing that she didn't even bring up, but we talked about early on, right, was, and we addressed like, do you have any major concerns, any fears coming in, or any like past kind of reservations? And we talked about VAD, vertebral artery dissection, right? And it's commonly approached as it relates to like a concern or fear about neck manipulation, right? And so in medicine, there's risk with everything that we do, okay? And so when people come in and see me and they have a raging migraine, neck pain, and it's insidious onset, I'm just like, whoa, wait a minute. So there's a lot of things that we have to pick up on the front end and it relates to history. Okay, that's the biggest filter that I have coming in is making sure I have a good idea of what I'm dealing with, okay? And then orthopedically assessing and looking at the neck and really putting them in a category of whether they're safe or not safe to adjust in that area, okay? And then there's a third step to that as well as it relates to it, and that is my application of force over an area that's not moving well, okay? So I'm not just like winging it when it comes to working on someone's neck, okay? And I think that applying the right technique and applying the right forces to areas that don't move well, and I've already checked off all those other boxes, I put myself in the best position to treat her well, okay? All right, so those are the three things that I do. And then if you really need more information about that, we talked about this, some of these big systematic reviews of the literature as it relates to that particular problem. If you really look at that stuff, and that's what is driven by the high level MDs that are doing a lot of these amazing research programs like Cochrane reviews and things of that nature, those are really well done. And what some of the more prolific ones have found that it doesn't even matter if you're seeing a chiropractor or your primary care, and if it's a relationship to neck pain and migraines that is the biggest causative factor, right? Yes. And acute onset. So when people come in like that and they did these studies, and you're more likely to have a vertebral artery dissection after seeing your primary care than the chiropractor. The primary care is not manipulating your neck, but what that study showed that there was that it's not a it most likely is not a causative relationship of the manipulation. It's the person that's in that pain, okay? Even though that is obviously a very intense movement on the neck, right? But when done right, when done to the right person, and when done well with the right application, it's a safe modality for neck pain, okay? So I'll attach that review, I'll attach some of those talking points. It's a hot topic, and I don't talk about it a lot because it's just heavy, but it's an important thing to understand for sure for you and for other practitioners to really have a good understanding of, like, what are those factors that people look at that make you an increased likelihood of having a stroke, right, or a dissection. So hypermobility disorders are one thing for sure. A history of smoking is another one. They've looked at hormonal drugs as well as being a component to it, and then age, gender as well, females. So there's a lot of components that you look at that categorize patients in that population, in addition to all the other things I just said. So I hope that helps you understand it. And sorry for digressing so much on your treatment here today. And she came in, she's like, I just worked like 4 days, 18 hours. And I was like, oh, do you mind if I burden you with doing a video real quick? Your one time.
Let's do it. We like it.
Appreciate
we like
you. Thank you. I appreciate that support. And she came from, you were in shock trauma? Where'd you work before?
I worked in neurosurgery, neurology, and a stroke unit for a long time, 13 years.
There you go.
Yeah.
So she comes from that background, right? And I appreciate her just like bringing it up front with me and just being real.
Yeah.
And then also just having the patients to kind of hear my side of it relative to that. So, but for right now, let's focus on taking care of her. Okay? Yeah. You can stand on up. You're gonna sit right here, facing this way for me. When was the first concert you ever went to?
Oh, yeah, that was Roger Waters. Roger Waters at Nissan Pavilion.
Roger Waters, what kind of music?
Like Pink Floyd.
Oh, really?
Yeah.
Play. Hey Alexa, play Roger Waters playlist on Spotify. Eastside Pavilion?
Nissan down in
Nissan.
like Fairfax area.
Oh, I've never
Fair
been.
Oaks. Oh, it's a great venue.
I'm going down to DC for a show on Friday.
Oh yeah, what are you seeing?
A band called Camp.
Okay.
It's a little more chill, like in the summer, relaxing music.
Nice.
And it's my brother-in-law introduced me to it. It's like late music.
Okay.
So it'll be, I don't usually see this kind of band in person, but I'm excited to go. Have you been to the Anthem on the Wharf in
No,
DC?
I have not.
It's a cool spot. Cool area. DC's awesome. Bring your head back for me. And bring your head down. Head back. Head down. Put your hair over there. Head back. And head down. All the way, go. Head back for me. And head down. No, you're good. Is this a cover?
I don't know. It's something, maybe a cover. Roger Waters is the same one for the singer.
Oh my gosh. So it's him. This is Pink Floyd. Yeah. I've seen him twice, a cover that is,
Oh yeah.
in St. Louis.
There are a lot of good cover bands. There's a lot of like good Led Zeppelin cover bands.
Mm-hmm. Pink Floyd, Led Zeppelin. Reach up. You relax your left arm, you're good. Reach up. Good. Nice. Good, now across your body again. Is that it?
Yeah.
Tuck your chin, turn to your left. Head down. Turn your body to the left. Nice. Relax. I'm going to rotate you and adjust your right upper mid back. Elbows together, hands on your cheeks. You okay right there? Okay, I'm going to turn you and create force up into that space. Rest. Nice. And then relax. Go ahead and stand up for me. Awesome. And then I'm going to bring this table up, okay? Yeah, good. And then I'm seeing Leon Bridges. Man, he's got a smooth voice. It's kind of eclectic, but R&B. Line your stomach for me. Seeing him in the summer.
Nice.
Yeah. I don't know, I was playing.
My daughter's trying to convince me to take her to a Korean band.
K-pop?
Yes.
Hell yeah, K-pop.
Oh gosh.
That's gonna be a lit show. It's gonna be so much fun. Are you gonna go?
I don't know yet.
Yeah, you're so gonna go. Good. Nice. Now you can breathe again. So where are you taking her to see that?
She wants to do it up in New York, in Queens.
In Queens?
Yeah.
In Queens?
Yep.
It's funny. We were in Manhattan a couple weeks ago. I love New York City, and what a cool place. Anyways, and they were telling me not to go up towards Queens, but I don't know Queens like that.
Yep, I don't know it at all.
Is Queens over on east? Is it north of Brooklyn?
I have no idea.
Shoot, what is it? Oh man, yeah. Anyways, sorry for the people that live in New York. They're just like, shit.
I'm not trying to give out any free judo lessons.
I hear you. I hear you. Take a deep breath. Easy. Don't worry, wherever you're going, you will be outnumbering everybody else. That is for sure with the K-pop show. Strength in numbers in those organizations. I used to go to concerts and treat artists before they'd play.
Oh, cool.
It was before children. Before that, there was like, before I chose to have my free time and doing stuff like that. I should say that. Because I choose
There you go.
my free time to be with my kid right now.
Happy belated Father's Day.
Cheers. Thanks. It was a great one. I sat on my back porch. I ate blue crabs with my dad, my Uncle Mike. So two good talkers, you know. I just sat there and ate. And my middle one came over and just smashed crabs with a hammer in front of me. Solid start to her crab career at 2.
Nice.
That was good. You okay here?
Yeah.
Alright, good. Alright, you moving well. Just a little release here. Okay, lie you on your right side. Take your time getting there, your left side up. We got you. Press your hands. A little stretch, easy release here. There you go. Good, a little bit more pressure. That's fine. Okay, come on your back. Lie on your left side, face that way. I actually, I like to cook, so I was like, Chris, I'm gonna go to the grocery store to get dinner tonight. She's like, no, I gotta cook for you. I'm like, no, I'm gonna make the most epic meal. And I had a great Alfredo pasta on the side. I got some steak. That was it. It was fantastic.
Okay.
That and crabs as an appetizer. I was like, I'm set. Nice. Okay, good. Some gentle traction on your neck, okay? Put your head up for me and rest it down. Good, easy. Good. Blade adjustment right there, okay? I got you. Relax your jaw. Good. I'm gonna take you from here to here. Good. Traction all the way down. Perfect. I hope you feel that pressure from the last 3 days is gone. We're gonna do a little bit more work. And thanks for watching. Thank you for doing the video with us. I appreciate that. I hope you enjoyed, learned something, or whatever. And take care.
Hey everyone, Dr. Angie here. We got Bella. We're dealing with some back pain, more so on the left side. All right, we got some mid-back stuff going on, so we're gonna check it out. We think we might have some rib fixation going on. How long have we been feeling it?
Yesterday, this morning.
Yesterday, okay.
Yeah,
So
nothing
not like
crazy.
we've been dealing with it for a week or something,
No.
but just the leaning over, bending,
Yeah.
reaching,
All
picking
with
up
the
a kid.
kids.
Yeah.
You know, the little finger.
Hand holding as you're walking around with them.
Spend a lot of time in this position.
We don't want to end up like that. All right, let me have you go ahead and lay face down for me.
Meow.
And you got the armrests up by your side. There you go.
Dun, 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 dun.
And you get all the beautiful, luscious locks out of the way. There's some of them already.
Ah.
Yeah.
Yeah, you
Right
feel
in here?
that? Yeah.
Okay. Not a ton of low back stuff going on, or just tight as usual?
Just tight. I do a lot of bending.
You do.
The whole spine is not happy.
All right, I'm gonna do a little lift with your hips here. One hand on the front, little lift and twist. Good. One more. Good. A little bit of the rib, right? All right, we're gonna do that same thing on the other side.
I love those ones. They're so cool.
Right?
You're like the only doctor I see that does this adjustment.
I think I'm the one that kind of introduced it to him. There it is.
Ah,
Yeah.
I love that one.
Breath in for me here. And breathe it all out. Good. Yeah.
My neck's always got a lot going on.
Go ahead and let your head kind of rock. Flip to the side. Maybe drop it.
Aha.
Yeah, you got it on the other side too.
So nice and yummy.
There it is.
Whoa. That was a good one.
That was a good one. All right, I'm going to bring you on up. I'll have you turn over. Actually, go ahead and lay on your side facing me. We're going to get the lower back too. Because
Woohoo! Because why
you
not?
need it.
You never, no reason not to. Might as well.
Slide a little bit closer. Perfect. Breath in for me. And breathe it all out. Good. Nice. And
Such
the
a
other
cool
side.
low back adjustment. So cool.
You're quite crunchy.
You are crunchy.
Oh, I know.
It makes it better for videos,
I
right?
love that I'm crunchy.
Breath in. And breathe it all out. Good.
Oh,
And flat on your back.
so cool. People watching are probably like, how does she do that? I don't know.
Yeah. It's
It's
magic.
all in the flick of the leg.
Oh yeah. How's that feel?
Yummy.
Yummy? Okay.
Yummy.
Does it radiate anywhere? Not getting headaches or anything? Tension there?
It hasn't moved yet.
That's good. You don't want it to move.
No. I do soft tissue like pretty regularly
Good.
throughout the night. So it moves better.
Oh, I like the pearl earring.
Oh,
that one's
thank
cute.
you.
I like all of them, but that one got
Pearl
me. I was like,
specifically.
ooh, yeah.
Stretch those traps.
Yeah. Oh yeah.
Oh yeah.
Felt that one?
I did. Nice. Art 2.0.
Right? All right. Little adjustment here. Let your head rock with me there. Good.
Yummy.
And lower on this side. Good. Extra crunchy. All right. Awesome. All right, we're gonna go for this one first. Let me,
We're doing a wraparound?
let me get this in the pocket.
So let's not stab you with the
Yeah,
ring.
I was like, no stabbing you or the table with the ring.
Table will be fine.
And breathe it all out. Tiniest bit. You
little
might have gotten a lot of
baby.
that on when you were face down. Same thing over here.
I think I'd move better face down than my ribs.
Yeah. Go here, breath in, and breathe it all out. There it is. Nice.
That was
All right.
nice.
got
Thank
'em.
you.
You're very welcome.
Now I can bend and move all day.
All right. Awesome.
Nice.
Feeling a little looser?
Yes, thank you so much.
Bend down. Do you feel that pull in the rib?
No.
Wonderful.
That's awesome.
Yay.
Thank you. Oh my
welcome.
goodness.
Hey everybody, my name is Dr. Ward. I'm in Towson, Maryland, just north of Baltimore, with Ellie today, and she just got her functional movement screen. So she just did an evaluation. She's getting ready to start a strength program, and she's been seeing me in the past for tension headaches and neck pain. I'm going to show you how we treat that, as well as speak briefly to the program she'll do. She'll be coming in a few times a week. And over the next 3 months, working out and working on getting stronger, working with the personal trainers. She's out of the kind of the problem that brought her in as it relates to feeling better. Sometimes things pop up here and there, and we take care of them if they do. But for the most part, she's doing really, really well. This is just what it looks like to get her neck worked on, as well as doing some soft tissue work. She's got some referred pain coming from the back of her neck, and she's got some jaw pain that's kind of spreading. So I'm going to work on those 2 areas today. She just woke up with it. You'll get to see just my approach to treating neck pain and tension headaches coming from the neck. And then, yeah, I'm just going to kind of pretend like you're not there, to be honest with you. The saffron you gave me, we're making paella this week. Come on.
That's so wonderful.
Yeah, thank you so much for thinking of us. Appreciate you.
Yeah,
It's awesome.
no problem. Yes, that's so wonderful.
Let's start with you sitting right here for me. We're going to do some soft tissue work on the neck and shoulder. You got to work with Amelia a little bit today, right?
Yes, Amelia's nice.
And she is lovely, isn't she?
She's very lovely.
I know.
Yes.
The team over there you'll like a lot. So you got your in-body scan, so you've got kind of metrics to work off of. We'll reevaluate those at the end of 3 months. You'll see the progress that you have with it. And then relative to that, you can, and I'll give you the form for it, you can reach out to Brittany, who's my sister. She is a certified health coach. She'll be working alongside our nurse practitioner. If you want to get any additional work done or work with somebody as it relates to dialing in nutrition and dialing in some other metrics that you can monitor through blood work. Okay? So it's going to be kind of a full team approach for you as it relates to you getting stronger. Bring your head back for me and bring your head down. So I'll give you that info for you, okay?
Okay.
Actually, Carly, can you give me that info for me?
Yes.
Bring your head back. Nice and easy. You're going to go back for me. Good. There you go. And then head down, nice and easy. Good. Chin to your chest. Good. And then turn. Boca arriba, por favor. And then chin down. So Ellie's bilingual. She helps me with my Spanish sometimes in here as well, so I appreciate that. Head back for me. Down. Rotate your head to your right. And brings me back gifts from her travels, which is also very nice of her. And then rotate. Tuck your chin down for me again. Turn your head to your left. So, to the right. Take your left arm and drop it over the side of the chair. Nice. Good. Rotate to the left. Good. To the right. So, although the setup seems intense, it's a really controlled, gentle adjustment, because I'll just get her to a comfortable spot. She's got pressure there. Good. And turn right. Good. And it's just like enough force in the right position. It doesn't feel, it feels intense because it's like a deep release, but it's not like, it doesn't hurt when I do that, does it?
No. Fantastic.
Fantastic. No se duele en su cuello
No.
cuando usa este ajusto.
No, no hay dolor.
And then rotate your left. Good. Un poquito más en la derecha, por favor. Rotate to the left. I got you. So, although she is looking forward to the relief, your body will I think a lot of people get concerned about becoming tense, you know, like holding on to pressure, and it's all good, because it's a natural reaction. There you go. For the body to like resist, because it's getting moved around, right? Without its own will. But if like with the right touch and patience, like that was just so smooth, it was just like a good amount of pressure just let go, and that upper cervical spine was really clean, easy adjustment, really focused on the right area that needed to move the right way, in my opinion. Let me see your left arm go across your body. Let me see. Oh gosh. Puedo ver su hombro y mano. Across. Adiente? No, what's across?
Cruzando.
Su cuerpo.
Sí.
Derecha. No, I stumble through it, but if I put enough nouns together, she can help me through it. Good job. And then bring your head down. Nice. So circles my intention headaches, and I want to work on the jaw a little bit and work on some of the sensory points that can cause some of that irritation. Loose, good. Good hand relax. So it's when I work with Ellie, I'm feeling, I'm moving. It's not just like I have pain here, so treat in this spot. It's like you have to assess the mechanics of the joint, like really palpate to see how things are feeling and moving, relatively speaking. And then after I work on it, go back and check that out again. See how it's holding up. Like a lot better on that right side. Left side is freed up for sure. Shoulder feels good. She's just in a better spot, and she should report feeling better. Come stand on up for me, please. Let's lie. Poco abajo, por favor. Okay, so I know that means mouth down, mouth up, but that's what someone told me was the right way of saying that.
Okay.
Poco abajo, poco arriba. Yeah, relaxing. There you go. Go. Rest. Like really gentle here, okay? Good. Just pressure from my hands, just like that. This table's a little squeaky, so good. Okay, and then relax your shoulder blades. Solid. Good. Let me bring the table up for you, and you're gonna go on your back for me, okay? And relax your head all the way. So you're home. You're gonna get to work here a little bit, it sounds like.
Yes.
You're back for a little bit. Do you have any fun trout?
Yes.
We're supposed to follow that. It's supposed to be like a.
Every time I have to do it.
I missed that. So.
Yeah, now I don't have my passport is being. I need to renew my passport. They are renewing right now, so.
I gotcha. So nothing planned right now.
Yeah, no plane.
Okay. Deep breath in. And settle. Do that again for me. Respirar un poquito más. And breathe out. Awesome. Okay. Good. Open your jaw. close it and relax. You're gonna feel pressure on this little tight muscle there. Okay? Be a little tender. Let me know if it goes above an intensity of like 4 out of 10. Right there. Good. Relax your jaw. Good. There it is. Good. Okay. Smooth. Good job. Way to let go. It's hard to let your jaw relax. That adjustment, but you did well. Moved just fine. So, you've been coming to see me for like a little bit. Your time here, relatively speaking, like, what would you say the team, the experience, what it's been like for you?
The team, it's a wonderful experience. Everything is so wonderful.
Good.
Yeah, I never had a complaint or anything like that. It's just everything's smooth.
Awesome.
I love it.
I'm glad you have that good experience. I really like, and speaking to the team and the quality of the people that we have here, it really is just shout out to them. Thank you. And I hope that if you're not in this area that you find good people that want to pour into you. And then I think what she's doing right now is she's taking a step towards taking a lot of action in her own health and creating a separate or a new identity around her movement practice and her exercise and fitness. And she's got the motivation of having family and being there for her grandkids. Like that's a really powerful position to come from. And I get so excited. Like this is very motivating to be around people like that all the time. Like this is my day because you know what a beautiful thing that is, right?
Yes,
and you're gonna take good action to take care of yourself right now. Like
Definitely. I just don't want to be a burden for nobody, and I just want to be free, working by myself, and healthy and. Yes.
I think we have a community. People come here, right? We have a community of people getting better and helping, and I'm just a catalyst for her to stay in that mindset, okay? Like that I think is true healthcare relative to it all. And she is controlling her own outcomes now. So I'm so excited that you're starting the strength program. I'm so excited that you'll have those connections if you need it from a functional medicine standpoint, nutrition, and if there's something that's bugging you or you're feeling like there's any pain, but also like from a wellness standpoint, I'm here for your spine, okay?
Yes.
And your joints, muscles. You can see I'm not just like adjusting the back, it's other things that we're doing in here, and that's everybody in this team. Jayla's giving me that look, I gotta go. Thanks for watching.
Thank you so much.
You're
Thank you.
welcome so
You're
much.
wonderful.
Yeah. I appreciate you. All good.
Doctor.
Mm-hmm. Yeah.
Thank you.
Thanks for watching.
Hi everyone, Dr. Angie here at Kalkstein Chiropractic, and we have Tanya here with us today. She's experiencing some neck pain. Tanya, tell me about it. What are we noticing today?
So really it started yesterday during yoga.
Okay.
I learned I couldn't do one of the moves and I was very like, what's a good word for it? I went to do the wheel and my upper back was like, nah, it wasn't
That's a tough
moving.
one.
Yeah.
There's a reason why it's not like not everybody jumps into that one. But are we feeling like upper back into the shoulders, or are we feeling it more in like the top of the neck?
Upper back into the shoulders.
Okay.
I do a lot of desk work, so
Yeah.
it's a lot of this.
A lot of this. No desk shrimps. We don't want desk shrimps. Okay. Let's go ahead. I'm going to have you start out laying face down for me. We're going to check out that upper back area. I'll look into adjusting the lower for you. And going down. Maybe. There we go.
Gotta love these tables.
Yeah. What's funny is that he fixed it.
I know.
Oh yeah. So we're finding a lot of taut fibers, really tight muscles, some trigger points. Any headaches associated with the neck and shoulder pain going on?
Yes, so I started getting headaches around like 2 days ago,
Okay.
and they come and go.
Gotcha. Did you notice it was worse after yoga?
Mm-hmm.
All right. So a lot of times trigger points, they have a referral pattern. If they're an active trigger point, it just causes, I don't want to say random, but random pain. And a lot of times trigger points here in the upper trap can refer pain up into the neck and sometimes around into a headache. And then we'll also get tight ones right at the top of the shoulder here. So those upper trap fibers, levator scap fibers, everything around that shoulder. Let's see if we got some matching ones on this side. Yeah. Try something for me. Just look up like you're trying to look at the window in front of you. Is there pain with that? Or
No.
Just tight.
Just tight.
Okay, go ahead and relax one. Alright. Good. Felt some ribs moving? We'll take it. Hold it here. Good. Alright, take a breath in for me. And breathe it all out. Good. One more. Right over here at the head of the table. Let your head rock with me here. Good. Nice. We do the same thing on this side. I'm gonna try that a different way. Sorry, Carly, it was in your way. There we go, this way. Let your head rock with me this side. Good, one more. We are extra tight there. All right, I'm gonna bring you on up and I'll have you lay on your back for me.
Okay. There's something in the middle of the road.
The fun things about having windows.
I know.
Carly's like, what's out there? I mean, not gonna lie, I do that a lot when I'm working on people. I'll be like, The worst one though is you hear a horn honk and you hear the screeching tires, and I'm like, one day I will hear the. Hopefully not anytime soon, but I'm waiting for it. One day it will happen. Oh yeah. All the way up into this left side.
Mm-hmm.
So we're gonna do a little stretch here. Let your head just rock with me. I'm gonna do a pin and stretch. Oh yeah. That was a lovely face. Mm-hmm. That's why I know I got the right spot. Good. Keep breathing. That's important. Keep breathing. Alright, so you got lower on this left side. Let it rock with me. Good. Awesome. I had a patient say the other day, they were like, you like this way too much. And I'm like, well, I do it for a living. I better like it. It's a lot of fun. There it is. Nice. Little pull. I'm just going to sit and apply a little pressure to the suboccipitals here. Mm-hmm. Just keep letting your head just relax with me. Alright, one more little traction here. Good. Alright, and I'll bring you on up. Yep. If the table will let me. Alright. And that is a cervical treatment. Does it feel slower?
Yep.
Okay. Thanks for watching, everyone.
Hey everybody, I'm with Marie here at Kalkstein Chiropractic. I'm Dr. Warren. I just wanted to demonstrate a really helpful approach with trigger points and myofascial pain. Marie came to see us about a month and a half ago with a lot of neck and shoulder pain. She had a hard time turning her head. We've been doing some soft tissue work in the form of dry needling and adjustments, and we really hit a good plateau. She was better, but we've recently been using radial shockwave, and there's probably three main types of shockwave you'll run in the public. One's termed miracle wave, another is focus shockwave, and this one you're about to see is radial shockwave. Radial shockwave is really good for myofascial trigger points. fascia in a superficial area that's restricted or tight. Think over carpal tunnel, think over plantar fascia, Achilles tendinopathy. But it has applications in conjunction with kind of more of your chronic neck, upper back tension and pain that can happen with bent over activities like gardening, etc. So when you first aggravated it, do you recall what was the initial thing that kind of set it off?
Computer.
Computer work? Okay, so that chronic kind of activity of like hanging out with your arms in front of you and doing something out in a seated position out in front of you that can put some stress to that area. I think a lot of you can relate to that. That's not foreign. But what is new, I would say, or something that might be helpful for you, and if you're in the Baltimore area, we've got this new technology, this as well as Focus, but if you're elsewhere and you're looking for different ways of combining conservative care around a problem, Shockwave is something that is really kind of is a nice approach in conjunction with active care and in conjunction with chiropractic care. So I take care of the joint mobilizations and adjustments and getting better movement in her spine, and then Thomas is going to come in clutch here with some awesome myofascial release via radial shockwave. And she had it for the first time last time you were in, and you seemed to like it. You seemed to respond really well. And it gave her way more lasting relief relative to this problem that she's been dealing with. And over the last month, it's been mostly trending up, but we're adding this into her treatment plan now. And we'll do it once a week for 4 weeks. And then she's got the opportunity to work with a personal trainer here to build some strength around that area, or just get back to the things she loves to do and just kind of maintain that momentum. So that's where we are. Thank you for taking time to demonstrate this for us. We appreciate it. And again, Radio Shockwave, if you have questions about it or what type of treatments it can help with, just ask AI, because it tells us everything. No, I'm just kidding. Comment below, and I'll be happy to help answer some of those questions. And I just want to show you kind of a real life example of it as it relates to how it works. And Carly's going to get some great footage of like what areas we work and how we apply it. So in like even in a lot of different clinical settings, I'll say this, it's being utilized for cosmetic purposes, for pain, right? Because it has a little bit of regenerative property to it. This one does, and then Focus has a lot more. If you kind of look into the research of how it's being applied, it helps stimulate certain growth factors, stem cell activity, angiogenesis, blood flow, vascular creation. So a lot of these growth factors that are stimulated through these waves of force, and this is a technology that is well documented from a clinical standpoint in research. They're using it for non-union bone fractures. They're using it in skin cases where tissue isn't healing well. So there you get that concept. It's not just about breaking things down. It's about healthy stimulation to the tissue. I lost my train of thought. Oh, when we apply it, we don't just put it on the problem that hurts and say that's it. We also use some of our background in active range of motion techniques like ART. And so for the newer clinicians that are out there, and for people that are utilizing this service for the first time in clinic, right? There's going to be a learning curve. I highly recommend you check out the Shockwave Academy down in Florida. Canas Medical did an amazing job of educating us. Dr. David Rudnick, who's in just near Boca Raton, Florida, who's just like on top of the research and an amazing clinician, really opened the door for me with this tech and using it in a totally different way that I would guarantee a lot of people are applying it as it relates to just its application. So you can be okay at this stuff, and you can just put it where it hurts and call it a day, and people will probably get still pretty good results. But we're going to take it to that next level and show you how we apply it with our background as it being musculoskeletal experts in conservative management. Okay? So, enjoy. Thank you.
Thanks, dude. Yeah. Alrighty. Ready to get started?
Hi.
My name is Thomas. I'm going to be placing some gel right up here, up on the neck.
Tomás.
And right up here.
Puedes usar movimiento con el hombro, un poquito con los músculos de el trapezius. I don't know what it's there. Later scap, trap, erector spinae, okay? Active range of motion, bend and stretch, and move right through those areas. Okay, specifically on the left side.
Gotcha. I'm going to grab some more towels before we get started.
Sometimes Warren will just bust out into some Spanish.
Test out his Spanish.
Yeah, just a little Spanish time.
Yeah.
He's showing off.
I'll have to get you to translate that for me later.
And subtitles.
How'd he do? Was it pretty good Spanish?
He actually is pretty good at Spanish, yeah. I'm very impressed. Alrighty, so we're gonna get started here. And most of that discomfort was on that left side, right?
Yes. Uh-huh.
Gotcha. So I'm going to be putting some gel down here shortly. And like Dr. Warren said, we're going to be doing some active range of motion as we're doing that shockwave on you.
Okay.
So I'm going to be giving you some directions here shortly about how to move your neck. But for now, we're just going to start kind of neutral and then work our way around the trap, up to the neck, and heading down towards that kind of mid-back, upper back. So place that gel down here.
I might wiggle around you if you don't mind.
That's fine.
Okay.
I need to protect my back. I'm going to use a chair. So I'm going to grab a stool. So you've had this done before, right?
Just once here last week.
How is everything feeling?
Much better.
Good.
It works.
So I'm just gonna go ahead and palpate around, looking for any bony landmarks or anything to avoid. Just mainly looking for muscle. All right, I'm gonna get started here. Kind of start at a low intensity and work our way up somewhere comfortable. Let's get started here. I'm gonna start here on the spin. How's the intensity feeling so far?
It's okay.
Start kind of moving up the intensity a little bit more. That's still feeling okay there? So next up, I'm going to have you bring your right ear to your right shoulder, kind of opening up this left side. Perfect. So far, so good. You can return kind of back to neutral here. And then your left arm is going to kind of hug yourself a little bit, so bring that to your right shoulder. Perfect. And then that's going to kind of help me out a little bit more as I'm hitting down towards this back. Alrighty. How's that feeling?
Good.
Let this gel down. Then we'll do that right side, but kind of a little bit less. Mainly wanted to focus on that left here.
Sounds good.
Make sure to get all the gel off before we switch sides. Lower the intensity back down. Okay, and now I'm gonna do some gel on that trapped neck and a little bit to the back as well. And then for this side, we're gonna have you start off with left ear down to that left shoulder, up opening up this side, and let's get started. Feeling okay on this side? We're gonna head down with the chin to chest now. Moving it up a little bit more intensely. Back to left ear, to the left side one more time. Oh yeah. Alright. That wraps it up.
Thank you.
Yes, no problem.